by our colleagues around the country in association with Public Health Law Watch at Northeastern University and the Center for Public Health Law Research at Temple University. We're here to provide expert legal analysis during the COVID-19 pandemic and hopefully to answer some of your questions. I'm Benjamin Boudreaux, a policy researcher at the RAND Corporation and a professor at the Pardee RAND Graduate School. Joining me here today is Jennifer Oliva, who is a professor of law at Seton University, and Ann Boustead, who is a professor at the University of Arizona. We'll be taking your questions towards the end of the broadcast. You can ask them in the chat box, or you can tag at PHLA Watch with #COVID Law Briefing. Today's topic is public health surveillance. In the context of the COVID pandemic, we've seen governments around the world use a range of new technology-driven surveillance capabilities to do things like contact tracing, to map populations, to track symptoms, to enforce quarantines, and even to issue health and immunity passes. A number of these technology-driven approaches augment traditional public health interventions, and they might perhaps improve on our approaches to responding to COVID-19, but they also introduce perhaps new and worrisome privacy considerations. So with that, I'll turn first to Jen and ask her to lay out some of the legal landscape at the state and federal level to allow them to conduct public health surveillance, in particular with respect to sensitive health information.
Great, thank you. This is an unfortunately complicated topic, so I'm just going to do a brief overview because Ann and I have lots of other things we want to talk about. But from a public health surveillance perspective, the core sort of legal authority come from two primary things at the federal level: the 10th Amendment and the states' right, the police power that the states have under the 10th Amendment to protect public health and safety, and then federal statutes, so the national emergency statutes and state and local statutes that give boards and state public health authorities the rights to have powerful policing authority in the context of declared emergency by sort of a state governor or mayor. That's the power on the one side. On the other side are a patchwork of laws, some that have really particular applications on the federal and state level that allegedly protect privacy. So we don't have, unlike the European Union, et cetera, we don't have a singular federal data protection law or federal privacy law. The statutory side of things, privacy is protected by a patchwork of law, sector or industry based. So we have laws that protect information, we have laws that protect consumer protection data, we have a Secure Communications Act that protects email transmissions and other sorts of things like that. And on the health side, we have the HIPAA statute with the high-tech amendments that protect health data. Each of those statutes have their own strengths and weaknesses. Like I said, they're sector specific, and even within those sectors, they often only apply to particular kind of covered entities. So they don't just because the data might fall into that category doesn't mean that the data holder is actually obligated to protect your privacy under the statute. And HIPAA is quite famous for that, since we're going to be talking about health data today. The real question here, if someone was asking me to do a HIPAA analysis, would be, is Google, because they're contact tracing you or they're following your geolocation, healthcare provider? And if they're not a healthcare provider, clearinghouse or data plan, they're not a covered entity, and the statute would have no coverage whatsoever. So there's a lot of complex issues. There's also federal constitutional laws that are implicated here, and unfortunately there are many. You could have Fourth Amendment issues around searches and seizures here from data collection, particularly if the government or law enforcement to share or use that data, and that's already been going on in particular jurisdictions. You could have against self-incrimination when the government compels you to give up certain information that could reveal things about you that could subject you to prosecution. And perhaps the most robust constitutional protections right now on the federal level, and people have heard a lot about this, that are implicated are the civil liberties that the First Amendment protects: the right to association, the right to petition and protest, the right to organize religion, and the right to free speech. So the First Amendment has a robust panoply of civil liberty protections that this sort of stuff implicates. So, and then on the state level, to make this even more complicated, and I'll end here, all the states have some sort of data protection law, but they're very varied in how they apply. Many states, California being the best example, just put into effect a statute in January of this year that is quite comprehensive, much more like the European law. But again, it only covers folks who do in California at a certain level of business, and so it's not universal again. So there's any number of privacy laws. There's also, we've got 3 or 4 constitutional provisions to play here, state laws, and then we have all the public health authorities. So it's quite complicated to do an analysis of all sorts of different legal authorities come into play when we talk about public health surveillance.
Oh, great. Yeah, thanks. That laid out a very, very complex landscape that, maybe we might be able to explore in a little more detail. Turning now to Annie. Now, we've seen states and the federal government being seemingly in a big hurry to try to integrate technology-driven approaches to some of this public health surveillance. So I'm wondering if you could speak a little bit about some of the effectiveness of these technology-driven approaches and what are the conditions under which they might work?
Absolutely. Thank you very much. So contact tracing in one form or another is going to be a really important part of the next year of our lives. And I think the first thing to kind of think about is that invasive doesn't mean effective in this space. There's like an overwhelming sense that, no pain, no gain. And the more information we're collecting, the better outcomes we're going to have and the more we'll be able to fight this thing. And that's not particularly true in this context. A lot of it comes down to not just how much information you collect about individuals, but how widespread your information is. You need to be very concerned about the uptake of tools and the usability of tools. A very well-defined tool that collects perfect information on 3% of the population still only has information on 3% of the population. And when we're talking about essentially a networked phenomenon, that's not going to be very helpful. There are a lot of kind of built-in information collection mechanisms that already exist. Your location is tracked by your cell phone provider. It's tracked through GPS. It's tracked through cell site data. All of these forms of information collection raise real concerns with regards to privacy, particularly because use of these data is very centralized. It's collected and compiled by commercial entities, often within central locations, leading to very limited personal control over the data. One of the things we're starting to see now, which I think is really interesting, is tech companies exploring ways of managing data collection with fewer privacy risks and more individual control. So I'm specifically thinking about things like that Apple and Google are proposing relating to use of Bluetooth low energy exchanges to obtain information about who you've been in contact with that's stored on your phone and it's kept on an individual's device as opposed to centralized, in a centralized mechanism. But what I specifically want to point out is that the behavioral components of implementation are just as important as the technical ones. If we try to encourage use of apps by doing things like, tying employment to your willingness to download and use an app that would trace who you have contact with, we're asking for avoidance behaviors that would undermine effectiveness. If my job and my ability to go to work depends on me, being willing to share enormous amounts of information about myself, I'm going to come up with ways of, making sure I get the right things, regardless of what my behavior actually is. Even if your employees use, it's not as helpful if others don't. So even if we get really widespread use amongst Uber drivers, for example, it's not going to mean anything if Uber drivers are the only ones using it. It also can lead to a false sense of security, which is something we have to be careful of. Is people saying, I'm contact tracing and my phone says I'm okay, so I'm okay. Your phone doesn't really know everyone you've been in contact with. So being careful there. And it's not just the behavior of people being surveilled, but what's done with the information once it's collected. So what does it mean when your phone says that you've been in contact with someone who has COVID, who's just been diagnosed with COVID-19? Are the police going to show up at your door and tell you to quarantine? Are you going to get a phone call from the public health department? Are you going to get fired? Or are you going to get laid off? Are you going to get a forced leave without pay from your job? And all of those factors are going to affect how people interact with this. And similarly, I also think it's important to think about the auditability of this. If my phone tells me I've been exposed to someone who has COVID-19, but it turns out it's a false positive, do I have a mechanism in place for not being quarantined for 2 weeks because of that? And a lot of what goes into ensuring we have good implementation is trust. So trust is really important for managing the behavioral implications of this. There was a Washington Post University of Maryland survey that came out yesterday, which found that 59% of US adults surveyed would use a smartphone app that was basically designed for contact tracing. 41% would have been unwilling, and 18% didn't have a smartphone and couldn't have participated even if they wanted to. And what was really interesting is they asked, who would you trust to keep the data anonymous? And tech companies were the least trusted. So 43% of people would trust tech companies to keep the information anonymous. But public health entities were the most trusted at 56%, or 57%. And actually, academics were almost as trusted at like 56. So it was like 1 percentage point off. I just want to put that out. And then finally, and I think this is a really important point to kind of close on. These systems need to be designed for the privacy interests of vulnerable communities. One of the things that's become really obvious throughout this is the interconnectedness of health. So if one person in your community has COVID-19, it creates risk for you. So everybody's health is really interconnected. And vulnerable communities are most likely to be in essential jobs. So they're most likely to be doing things like working in grocery stores, all of the jobs that people can't opt out of during this crisis, which is they're also most likely to be the hardest hit. They have least bargaining power, and we're seeing the widest spread of COVID-19 in these communities. And so if we if we create systems that exclude them, or that they can't participate in, or that they're nervous to participate in, we're really both putting them at higher risk, and they're already at very high risk, which is a problem. And it's also undermining the effectiveness of this in general, which puts everyone at risk. So when we're thinking about the privacy interests of the state, we really need to think about the privacy interests for the most vulnerable people. That's my script.
Thanks, Annie. Jen, would you like to add anything in terms of how you see the privacy risks associated, in particular, with these technology-driven modes of surveillance?
Yeah, well, I agree with everything that Anne said, and I just want to emphasize, and she said, about kind of problems, and one of the layers, not better now, that I like to add is, not only did she just point out all the over-inclusive, under-inclusive cascade of potential collateral consequences surrounding this situation, but she alluded to something that we often ignore, which is that we have had a failure of policy in addressing the COVID crisis from the jump here in the United States. We've been very slow to react. We don't have widespread testing. Any number of problems, clinically reported problems, been scientifically rushed through, FDA approval, etc. Some clinicians have reported up to 30% false negative rates, nasal swabs when they're performed by emergency and things like that. I can only imagine what the rate would be for at-home testing with the layered incentive that Anne pointed out of, I really need a job, and also I'm not an emergency room physician to take the nasal swab. Serology tests also in the air. We don't have the scientific things in place to make these apps as helpful as they could be if they were perfect and they were widespread, and we had taken all the things into consideration that Anne said. So I'm particularly concerned we're trying to throw tech that Anne already explained to you has all sorts of layered problems associated with it at a situation we have very sort of imprecise science to go and on the move, and everyone's trying to do things really quickly. So it's just layered imprecision that can lead to a cascade of bad results. And ultimately, to our last point, probably the worst outcomes for the people who are most vulnerable in our society.
So yeah, maybe then, turn it back to Annie. You mentioned trust and the importance of sort of privacy protection to enable these technologies to be useful. What do you think is the appropriate approach to try to build that trust? With the Google Apple protocol that you mentioned, they've sought technologically to build in certain features. So, for instance, the Bluetooth beaconing is anonymous and randomized. But are there things that we should see happen at the state or federal level to help bolster this type of trust, to actually get these technological approaches to be helpful?
So I think part of the reason why privacy is so important is that privacy breeds trust. It's showing people you will protect their information, and that's a priority for you, is one of the ways in which you earn their trust to give you that information in the first place. And I think the fact that we're trying to build a public health surveillance system essentially on the back of existing surveillance systems, which don't necessarily encourage trust, may lead to pushback and like lack of adoption amongst communities that have traditionally been targeted by the surveillance systems. So that's going to be like something that's going to be a problem. Building a contact tracing system off of Clearview AI means you're building in all of the distrust that's been built up like with that organization and the community. I think that's going to be a concern. I also think that this is a really great opportunity for public health companies, public health organizations who are already very, very strapped. They're underfunded. They have a lot to do in this circumstance, and they're in an emergency situation. But I really think it's going to be important to have technology that's designed for the interests and the needs of public health, rather than public health trying to figure out like what they can accomplish with the technology. What I really like to see driving this space is the public health interest at stake, rather than what companies are willing to and able to provide in their first assessment. One of the things that's become shockingly clear through all of this is that people, like just as a general thing, is that people think their expertise is much broader than it actually is, and I'd really like to see apps that are designed not just by tech people, but tech people who've really thought through like what information is needed from a public health perspective and all of that. So just because you can design an app doesn't necessarily mean you have the public health expertise to design an app that's going to be effective from that perspective. And I'd really love to see, cross-cutting collaboration that's driven by the needs of the public health sector.
Jen, would you like to add anything?
Yeah, and on the trust issue, she's actually done out of the tech. We also have, and you all know this, an extravagantly long history in the United States, the government, the federal and state governments grossly abusing power when they've sort of implicated privacy in the name of sort of national security and things like that. I mean, the Patriot Act and post data collection with that been now invested. There's been gross abuse. Most of those laws that are problematic and privacy invading were not very productive, but yet are still on the books. So one of the here that has been raised over and over again is how long will, whatever data is collected, how long will the government be able to have it and cling to it and hold on to it and go back and use it? Who will it be shared with, etc. We have a problem right now in the United States that if you even take the tech out of it, several southern states, and I just want to point this out to people, immediately contacted first responders, people tested and gave them people's addresses. And that created a cascade of problems and solve tech. It was a simple thing. We gave you the address. So now you're more worried to go into those communities. You're slow to respond. You're sort of suit when there you go in there. The police in Indiana went so far as to say that they resuscitate people who overdosed from drugs because they were susceptible to contracting coronavirus because of that. And then the police, it's an occupational. And Anne pointed this out in her first bit here, to become overly lax, confident, because I have this address, but everything's fine over here. So I'm going to let my guard down. Whereas this is a situation that demands vigilance at all times. People are asymptomatic, how long the virus sort of lingers around, how long it can stay on surfaces, and the like. So it's very difficult to trust the government when the police have already come out and done all sorts of things in particular communities already without even being enabled by this new tech that have undermined people's trust and confidence in how they'll be by the police if they have very simple, not too technical information such as their home address.
And just building off that, I almost forgot my favorite point, which is that as we're designing this, part of what we need to do in order to build trust and make the trade-offs are worth it is we need a very transparent, open, accountability, detailed accountability on how this is being used, what it's being used for, where it's being implemented, and what the outcomes associated with it are. Because we need to be able to, this isn't going to be, something we're going to do once and then never do again. This is going to be an ongoing thing, and we're going to need to figure out how to do it as well as possible in ways that threaten people's privacy as little as possible. And the way you do that is through evaluation, and you do it by, releasing information about how it's being implemented and who's implementing it and what data they're collecting in the whole 9 yards. So what I would really like to see in addition is like a really robust transparency framework that isn't just we are working with this company, but it's, there are this many people interacting with the apps in our community. We see this many, connections. We're seeing them we're seeing them concentrated in these places. Something that is detailed enough that we're able to understand whether or not this works. Because I don't think I think if, undertaking actions that have privacy consequences may be appropriate given the scope of the emergency. But I don't think we should necessarily assume that any actions we take are going to improve everything. So we need to be able to develop evidence and best practices so that we can do better into the future.
Yeah, and maybe just to add to that, I mean, there's the risk, I think Jen was alluding to this, of the sort of surveillance creep, that once these programs are enacted, they become very sticky and there's a tendency for them not to go away. And so these auditability functions, the transparency mechanisms, and things like sunset clauses will be, I think, particularly important to ensure that these programs are actually serving the public health interests. We're coming close to the end of the time, but I do want to turn it over to Jen for any final comments, and then maybe final comments from Annie, and then we'll close.
My final thoughts are, I think that what's important here is sometimes we do sort of balance liberties against public health surveillance and the public health, and that's appropriate. But we have, and the public have been hollering this, January, COVID has exposed any cracks in our healthcare system, in our social service safety net, goes to social determinants of health. We've seen particularly vulnerable individuals more throughout the crisis, and so it's exposed all the structural problems that we have in the United States. And I'll let Anne do this, but I am very concerned about the concept that we can fix those things which we cannot. They were broken before we started here. Technology, more pervasive surveillance, that in and of itself has all the problems that Anne pointed out. I would urge people to be extremely cautious and to hold government and public health officials accountable, because I can guarantee you, I'm not a technology analyst, but that technology is not going to fix the fact that we had a broken healthcare system and a broken social safety net that exactly this crisis has from the beginning.
Okay, so thanks, Jen. And then just to close out, I would say that it's important to as we're trying to manage this and figure out kind of what interests are at stake. I really want to make sure that we, the public health considerations and the privacy considerations, we're trying to manage multiple interests, but they're not mutually exclusive. I think it's a bit of a cop out to say, the privacy interest the public health interests can necessitate information collection that otherwise would be unthinkable, but the privacy interests are still there. And a well-designed public health surveillance system will take those into account, and they'll take them into account for vulnerable communities. And it's not that, it's not, hamstringing the public health surveillance system to do this, it's making it stronger. The best data collection and getting good, accurate data collection is going to involve collecting data with the participation, with the cooperation of communities across the board. And you get that through trust. So privacy is a necessary component of public health surveillance. It's not something we have to overcome in order to get good public health surveillance. And so we're managing multiple interests that are going on, but they're not, we don't have to pick one or the other. What we really have to do is figure out how to get both.
Great. Thank you very much to both of you. And thanks to you all in the audience for listening. Just to note, again, we'll be broadcasting here on Twitter at noon every Tuesday, Wednesday, and Thursday. Just go to the @PHLA Watch or search for #COVID Law Briefing. The shows are archived by the Week in Health Law podcast. And these briefings are produced by Faith Hollick and Bethany Saxon. We'll see you next time. Please stay safe. Thank you.